Good day, everyone! We are the Science Geeks from Science 11 X4. We are Castasima, Calzon, Concepcion, Cordero, Cruz, and Digisman. Now, we will be presenting our own concept map of a living system. Our system is called the COVID-19 system, which comprises of several parts with specific functions that will be further discussed in the following slides. The dramatic spread of COVID-19 has disrupted the lives, livelihoods, communities, and businesses worldwide. Organizations around the world are coming together, innovating to minimize the impact of COVID-19 to public health and to limit disruptions to economies and supply chains through vaccine development, which is highlighted in our system. To know more about our system, let's move on to answering the guide questions. For the first question, is our system a living or a non-living? Since the system being covered by a group is the COVID-19, which demonstrates how a viral infection spreads through biotic factors, especially humans, as well as the involvement of the immune system and the route to fight against the virus through vaccine development, it is then generally considered a living system. Meanwhile, there are visualized processes such as approval and distribution phase that include non-living entities like industries and government. Therefore, our system is also influenced by non-living components. The second question is about identifying the parts of our system, and to answer this, the major component of our system is the virus, which is regarded as non-living but considered living since it resides in host. As it is the basis for creating vaccines, it is then identified as the input of our system. The third component involved in our concept map is the transmission of the virus from person to person through coughing, sneezing, conversing, and touching contaminated surfaces or objects that thus affect the community negatively and greatly. To solve this emerging public health crisis, organizations and government established the highlighted component of this system, the vaccine development. It comprises of early general stages, namely exploratory and preclinical stage, to categorize and determine the path of how to develop the different types of vaccines that will be available to the public. These categories are inactivated vaccines, nucleic acid vaccines, and viral vectored vaccines. Inactivated vaccines use the process of virus inactivation during the developmental stage, which resulted in the creation of Sinovac. Meanwhile, the nucleic acid vaccines are those that use COVID-19 genetic material, which gave rise to Moderna and Pfizer. The viral vectored vaccines, on the other hand, produce the Johnson & Johnson, Sputnik V, and AstraZeneca by using a modified version of a virus that is not the virus that causes COVID-19. Moreover, among the general steps of vaccine development, one crucial part is the clinical trials that are composed of phases 1 to 3. In phase 1, small groups of people receive the trial vaccine to confirm if it generates an immune response as well as to determine the right dosage. For phase 2, the study is expanded and vaccine is given to various age groups in different formulations with multiple trials done for evaluation. Then in phase 3, vaccine is given to thousands of people and tested for efficacy and safety. After the cautious process taken during the clinical development stage, there will be the formulation and creation of the vaccines. Then, the next stages follow. Stages of vaccine development that are categorized as external, non-living factors influencing the system, namely the regulatory review and approval stage, which in this stage the vaccine is being tagged as approved and not approved. If it is approved, it will proceed to the procurement and distribution phase. Lastly, after the distribution phase, a quality control phase will be done as the final stage of vaccine development to proceed with vaccination. The later discussed view on the effect of a vaccine to human immune system is the specified output of the system, specifically the individual's immunization acquired from the vaccine. For the next question, do the parts of the system affect each other? Well, yes. The components of the system are interrelated and arranged to accomplish a certain goal. As shown in the model, a mistake in one part will have a detrimental impact on all the other components, as there is a linear progression of steps and processes visible in our concept map. To specify, the existence of the coronavirus gave rise to the creation of the vaccines, that in turn affected the human immune system. We can say that without the evolution of the virus, vaccines that complicate human bodies should not have been developed. Thus, the parts of the presented system are interconnected and affect each other's goal and path.
Do the parts together produce an effect that is different from the effect of each part on its own? The whole system works together to get each person vaccinated. The vaccine development works only for its own, which is different from the purpose of the whole. It works as a systematized process to develop a possible vaccine for immunization. In this process, there are two paths taken in the regulatory review and approval stage that result in significantly different effects. Having vaccines approved means that the vaccine development process will continue. Meanwhile, if it is assessed as not approved, the process will be halted and the whole procedure will return to the first stage for reassessment and re-examination if the defects on the vaccine can still be modified. Simply, these smaller systems work hand in hand to complete the whole story of how one gets vaccinated. from the vaccine development to the building up of defense against this virus. Each part is critical to the overall system, so if one fails, the entire system is affected. Thus the effect, the behavior over time, persists in a variety of circumstances. Our model features COVID-19, which is timely, and the behavior of this system, when observed for an extended period of time, can lead to various possible outcomes depending on which factors or parts are dominant in the system. An example of an outcome of the system is when the vaccine development is lower compared to the aggressive transmission rate of the virus, leading to more casualties within the community. Meanwhile, the opposite of the previous outcome could be achieved as a result of a faster rate of vaccine development, creating higher immunization within the community that can block the transmission cycle of the virus. These are some possible outcomes that can be perceived given the varying conditions that can happen to a system over time. Moreover, studies show that the virus may mutate, evolve, and adapt to a variety of settings. Despite this, the system still has the same goal, which is to protect and immunize individuals. The modifications may also be in the development of vaccines for other viruses or severe variants of COVID-19 virus. Hence, the impact persists in a variety of circumstances. Again, we are the Sci Geeks, and that will be all. Thank you.